Welcome everybody for our weekly update on the situation with COVID in our community and our country. And we're going to go straight into our update. And the idea behind these updates is to share the information together as a community and to have the perspective so we know how to act and to respond and to know what to expect and how to prepare ourselves. And then at the same time, also to have a chance to daven together, to say Tehillim together, and to share some words of Torah. But we're going to go straight in now. Dr. Richard Friedland, thank you so much for your time. And if you will please share with us the latest situation from a national perspective. Thank you so much.
Thank you very, very much, Chief Rabbi and colleagues. I'm just going to share my screen, if I may. So just to demonstrate very, very briefly, and I'm going to go through this pretty quickly because everyone has seen this week on week, what happened over the last 7 days. And you can see here on the right that we've had a 23% increase in cases. Last week was a massive surge in cases in the Gauteng, but you can see week on week, pleasingly, only a 13% increase this week compared to last week. And despite this increase, there is some silver lining in the sense that I believe we have peaked at the end of last week, and I'll demonstrate why we believe that to be the case. But you can see across all of these provinces, and I'm only going to concentrate on the bigger ones, still significant increases. There is only one of our provinces in South Africa, the Northern Cape, that is in a form of recovery. It has peaked and is coming down, and the Free State is following suit. But if you look here on the right, you will see that compared to the second wave, we have been ravaged here in the Gauteng. And this third wave is 220% worse and more positive cases than the second wave. You can see the Western Cape has reached 70% of the cases in the second wave. And you can see that even though KwaZulu-Natal is only at 26%, week on week, there are significant increases. I think just graphically showing you that 23% increase and the fact that this third wave has now surpassed very significantly the peak of the second wave. And you can see that when we superimpose the different waves and how they behaved, you can again see in a different way how the third wave has now surpassed that of the second wave in South Africa, and this demonstrates it on a progressive week by week basis. Positivity rates are still extremely high in South Africa. Again, let's not be deluded by this. In some of the provinces like the Gauteng, as I showed you last week, positivity rates in the high 30s, and so it is extremely contagious, this Delta variant. We still need to maintain absolute vigilance at these kinds of levels. Testing remains very high, which is a very important positive in terms of containing the spread of the virus. I want to show you what really has happened here in the Gauteng, and I alluded to this last week, is that you can see that all of the epidemiological experts were predicting a wave that would be lower for longer based on the beta variant, the variant that caused the second wave. Of course, we now know we are dealing with a Delta variant. And from the first week in June, we saw a blowout. And this precipitous exponential rise in cases is all due to this highly contagious Delta variant. And I can tell you from a hospital perspective, we are seeing a lot of young people coming into hospital in their 20s, in their 30s and 40s, who are extremely ill with this variant. One of the learnings for us in the past 3 waves is how important this reproduction rate is. And it's more important to look at it on a provincial basis, and it's more instructive than it is on a national basis. And so I want to show you what I've shown you before, is that we've seen a pattern emerge where the reproduction rate, which is above 1, tells us we're in a pandemic, precedes the peak of the wave. And you can see that this happens in the first wave, it happened in the second wave, and now look what's happening in the Gauteng is that our reproduction rate is coming right off from its peak. And that's really telling us we've probably peaked in the Gauteng and are now coming off. How long that peak will last is uncertain. We'll know in the next few days, but we're certainly, hopefully, approaching the other side of this very devastating mountain. And so what we did was to look at this differently. Yes, week on week, there's been a 13% increase in cases in the Gauteng, and that's largely driven by Friday, Saturday, and Sunday's huge numbers. But if you look at it on a 7-day moving average, you can see that we have just begun in the last 3 days to come off. And hopefully that trend will be continued when we see the numbers coming out tonight. Too early to celebrate, but a very good sign that there is light at the end of this tunnel, and we are coming off this very precipitous rise that we've seen and the exponential number of cases. If we look at it in the Western Cape, as I've said, they're nearly at 70% of the cases seen in the second wave. They've surpassed the first wave, and still a way to go. If you look at again, the shape of that curve, we're not certain if it's going to reach as high as the second wave, and hopefully lockdown is going to help flatten that curve. But the RT number is indicating to us is that the Western Cape still has 2 to 3 very difficult weeks ahead of it before we are out of danger in that province. Looking very quickly at the Eastern Cape, they are now in a third wave. They're representing cases that are more than 30% of the second wave, and an RT that is somewhat more modest, but nonetheless indicates that they still are in the danger zone for the next 2 to 3 weeks as well. And KwaZulu-Natal, even though the cases are relatively modest, we are seeing a lot of hospitalizations. I'm sure we'll hear from David the extent that he has been impacted there. But even though it is yet to reach a traditional or technical definition of 30% in terms of the second wave, what you can see from the RT number is that at 1.44, that is very significant, and that we expect cases to rise very significantly in KwaZulu-Natal in the coming weeks. And then lastly, I'm going to end with something that we've always traditionally looked at, is a conglomeration of the transmission rate, the reproduction here at 1.1 for South Africa. And I think based on this, together what I've shown you already in the preceding slides, would indicate probably that government will have no option but to continue for at least another 2 weeks the adjusted level 4 lockdown regulations. If I may just end there with one note, please be extremely cautious out there. We have seen a massive rise in the number of deaths, particularly in the Gauteng and across South Africa. This is a highly virulent strain. It is highly contagious, and we need to be extremely cautious now more than ever. Thank you very, very much.
Thank you very much, Dr. Friedland. Thank you for your time and your presentation, and for helping to give us perspective, and also for the remarkable work that you are doing in your hospitals. I've heard from so many people how you're moving heaven and earth to help people in the most inspiring ways. And we're also grateful to you, and may Hashem continue to bless you in your holy work. Now I'd like to ask Lance Abramson, Chairman of Hatzolah, to give us a perspective of what is happening in Johannesburg. And Lance, also want to convey to you, and please on all of our behalf, to your heroes there in the Hatzolah team, who are really carrying our community, and I know that they are doing it under enormous strain of the load that they're carrying. So may Hashem bless you all in your holy work, and please, if you'll share with us the latest perspectives on the Johannesburg, on the Gauteng scene. Lance, I can't hear you.
Lance, your sound is bad. We can't hear you. It's completely off. Still not?
Can you hear me now?
There
Yes.
we go.
Okay, brilliant. So I'm just going to share my screen and tell me if this comes through. Okay, can you see that?
Yes.
Yes, perfect.
Perfect. Okay, great. So this is feedback, obviously, from the Johannesburg community that I'll be showing you here. And unfortunately, last week, we had a very big week. We had 701 new patients joining the program last week. And that was, unfortunately, again, the highest number of new patients in 1 week for all 3 waves. So that was a very big week last week. This is what it looks like week by week. So this is the number of new patients to join the program in 1 week. And you can see the increase, that it gets very big. These 2 weeks here were in the 500s, and we were hoping that these 2 weeks, that the cases had stabilized. But then unfortunately last week, the cases went right up to here, up to the 701 mark. Where we stand today is about half an hour ago, we were on 560 nearly new cases for this week. And we've just got tomorrow to go. So we'll close off, we close off before Shabbos, our stats. And it's likely that we won't get up to the 700 mark this week. We're hoping that'll be the case. We don't know what tomorrow will bring, but we're hoping that will be the case. And we're hoping that this will be the first week where we see a decrease in the number of new cases. And we're really hoping and praying that will be the beginning of a trend that we see in the weeks to come. In terms of active cases on the program, so this is the number of patients that we're looking after at any one time. And just for orientation, the first wave we peaked at 263 active cases. On the second wave, we peaked at 333 active cases at one time. And as of today, we're sitting at 1,274 active cases that we are currently looking after. So that is a really huge number, much bigger than the second peak, which was bigger than the first peak. So very, very huge numbers in Johannesburg. And if you look at the shape of this graph, so that shoulder there represented about 2 weeks ago where we thought it was stabilizing. Then unfortunately it took off again. And in terms of active cases, we haven't yet seen that curve. But if the new cases per week start coming down, then this number over here will start following. And that's what we're hoping for. We currently have 67 patients on the program who were moved into hospital and are currently being treated in various hospitals around Johannesburg. We have 137 patients that we are currently looking after on home oxygen. And those are the patients that we are, hopefully can keep out of hospital. They're monitored very closely when they're on home oxygen. And if they need to be moved across, they are. But the hope is that we can keep them in their homes and free up those hospital beds for other patients. Just something interesting in terms of vaccine stats. So this wave in total, we've had approximately 3,200 patients so far. 3,200 patients in total. Of those patients, 290 have been fully vaccinated. Now, what I mean by fully vaccinated means that they've either had their Johnson & Johnson vaccine and they've waited the required amount of time for the vaccine to take effect. That's the 28 days. Or they've had both Pfizer shots, not just one shot, both shots, and then waited the required amount of time for that Pfizer vaccine to take effect fully. So 290 is still quite a number, 290 people who were fully vaccinated, who have nonetheless contracted COVID. But the good news is that of those 290, only 4 had to be hospitalized. That's only about 1.3%. And even better than that is that of all these vaccinated patients, we've had 0 deaths. So we haven't yet seen a case on our program, thank God, of a person who's been vaccinated who subsequently passed away. And that's where you see the real power of the vaccine. So I think it's very important for people to remember that just because you've had the vaccine doesn't mean you can't get COVID. You can still get COVID if you've had the vaccine. But the good news is that the vaccine is proving very effective, even against this Delta variant, at keeping people out of hospital and preventing death. That's all from me, Rabbi. Just a very big thank you to the team. As the weeks go by and the numbers stay high, it gets harder and harder for the team on the ground. Everybody's tired, and just I salute every single one of them for their ongoing efforts. And please God, we should see this an end to this pandemic, and the team can finally get some much needed rest.
Okay, send them our blessings. May Hashem bless them. They're really heroes and have carried our community through this. Please God, they should have the strength and also protection, to continue their holy work. And please God, we'll start to see the numbers come down further next week. Thank you so much, Lance, for sharing. I'd like to ask Loren Raize from CSO Medical in Cape Town to give the perspective of what's happening in Cape Town. CSO Medical in Cape Town do the same work as Hatzolah in Johannesburg. And the two organizations work very closely together. So Loren, thank you so much to you and your team for your amazing work. And please share with us the latest situation in Cape Town.
Thank you, Rabbi, and thank you again for having me here. I'll just share my screen with you as well. So unfortunately, the numbers that we are seeing in Cape Town is in direct line with what Dr. Friedland was talking about. Those are our cases that were captured up until the end of June. When I saw you last, I briefed you around about the 27th it was. And if you see there what we ended on in terms of June, it was just a massive increase. Even from the 23rd of June to the 30th, we saw a massive increase in cases. This is a comparison of cases just between the second wave in December and now the beginning in June. And you can see that this is quite concerning because this is the first week in July, which has already surpassed the first week in June. And those numbers are just showing, as you can see from the graph in June, just a steady increase week on week, which is it's very worrying. These are our total open and closed cases per day, which pretty much tells the same story. You can see that we are opening far more cases per day, new cases per day, than what we are closing. So the numbers here in the Western Cape rising, the community has been affected as well. We currently have 85 active cases on our program. Of those, we've got, I think it's 8 in hospital. Of those 8 patients that are in hospital, 2 of them are on a ventilator. So at this point in time, we are really urging people those that are eligible in our community to get the vaccine. Cape Jewish Seniors in Cape Town has set up a line that can help the elderly in our community to register for their vaccine. And they are contactable on that number there, 021-434-9691. They will either talk people through it or actually do the registration for them. So anybody in our community who is struggling, hasn't managed to get this done, there is help out there for you. And I really do encourage you to reach out to Cape Jewish Seniors. They're more than happy to assist anybody who needs it. And as Lance said, the vaccine has proven very valuable in preventing hospitalization of fully vaccinated patients who contract the virus. So we really are encouraging people, encourage your parents and your grandparents to get the vaccine. Over and above this, I think it's important for our community to note that the isolation and quarantine rules are not guidelines. They are very hard and fast rules. If someone in your home has tested positive, you have had a high risk exposure, and you then need to go into quarantine while they are in isolation. You cannot, it is irrelevant whether you have had the vaccine or not, you are still susceptible to catching the virus and, if not more importantly, passing it on. So I think that we've heard the horrific numbers that have come out of Johannesburg, and this is really the Western Cape's golden moment to just rise and protect each other and show each other love and do what we can to make sure that we are behaving at an extra level of responsibility in order to protect those in our community and also the greatest citizens of South Africa as well. We have a responsibility to them in our workplaces, in the shops that we're visiting. Please, we are asking people, stay home, cancel social activities. This includes our younger community. As it has been mentioned, there's more and more younger people landing up in hospital. And I just think that there's still so much that we can do. We shouldn't take this period for granted. We've seen what's gone on in Johannesburg. I too am hoping that the level 4 lockdown is going to help us flatten that curve, but we also play a very huge part in doing so. And I really encourage our community. I'm pleading with you, please stay home, follow the rules, sanitize, wash your hands, wear your masks in public, observe the social distancing. It's for your own benefit and for those of us around us as well. If you test positive, please register on the CSO Wellness Monitoring Program. You can do that on our website. There's an online form, which is www.csocape.org.za, or you can WhatsApp your name to 072 037 8971. Rabbi, I want to thank you for having us on here, and I want to wish all of the patients in all of our communities refuah shalema and much strength to them, that they should have speedy recovery soon. Thank you.
Loren, thank you, and please convey on behalf of all of us to your team our grateful thanks for their amazing work, and thank you for your presentation. And just want to mention two things in this context. One is the very significant statistics that Lance Abramson pointed out from a Hatzolah perspective with regard to the efficacy of vaccines in preventing hospitalization, serious illness, and death. And obviously that makes it a huge mitzvah for anyone who can get a vaccine to do so as soon as possible. And as Loren said, the importance of maintaining all of the safety regulations and protocols so important in terms of the mitzvah of protecting life. And now over to you, David Unterslak from CSO Medical in KZN. David, if you could give us a perspective. I know that you carry a lot on your shoulders on your own, with support. But if you could just give us a brief perspective of what's happening in KZN.
Good evening, everybody, and thank you for, first of all, these weekly updates. I think they're very important for the community in South Africa to get a perspective on what's happening. And I think to reiterate what Richard said and Loren said, and Lance said, the importance of these programs and these feed banks are invaluable to the community. As far as Durban's concerned, and as we know, the third wave hasn't even hit us yet. To put it in perspective, during the second wave, we monitored a total of 80 people, with 14 people hospitalized during that period, which was really the 5th of December to the 11th of January. So far, during the third wave, which is the 1st of June to the 8th of July, we have already monitored 83 people, with 9 people being hospitalized. During the first wave, we had 7 people that used home oxygen. We've already had 11 people use it during this third wave. So we've already seen a dramatic increase in everything that we're dealing with here. This excludes those either Johannesburg people or out of town people that we've attended to. This is really Durban community. And what we have seen also is monitoring of a lot more younger people. We've had from a 12-year-old, a 15-year-old who were actually quite ill. Fortunately, they are fine now. And of the 9 people hospitalized, a lot of them were between the ages of 40 and 60, which was very different to the second wave. As far as our active cases are concerned, we are monitoring 21 people at the moment, with 1 in hospital and 1 on home oxygen. But I think the significant thing here is we've had 31 new cases since last Friday, with 7 just in the last 24 hours. So we definitely feeling an effect here. And most of these cases from a track and trace point of view have been people who have had contact, either traveled in from Cape Town or Johannesburg, with family contacts that have then got sick. Not all of them, but a majority of them definitely have been through cross-border interprovincial travel. The other thing that we have added this third wave, or in anticipation of the third wave, which we didn't do previously, is close contact monitoring, so that hopefully we can pick up cases a lot sooner than we did last time. So when we track and trace, if we believe people have been in contact with anybody that's vulnerable or susceptible with comorbidities, we do a close contact monitoring, and we are currently close contact monitoring 63 people. So if you work it out, that's far more than we ever did in the second wave. And I think, as Loren said, please get vaccinated. Don't ignore flu-like symptoms. Take them seriously, self-isolate, and be safe. And once again, I do hope that the extended lockdowns, as Richard believes will happen, will help us prevent a serious increase here. Thank you.
David, thank you so much. Thank you to our entire panel for your time and your efforts, and on this briefing to the community, but most especially for all of your holy work that you are doing in protecting life, and the Pikuach Nefesh work that you are doing. So let's conclude this briefing with davening together. I would like to daven together to say Tehillim, and we're going to put the Tehillim on the screen. And if you'll just follow along with me, and we're going to say, because I think it's so important, as we know, that everything, all healing, no vaccine can protect, no doctor can heal, and without the blessings of Hashem. And so it's so important that in this briefing, we have not just the medical briefing, which gives us the perspectives and teaches us what to do from a mitzvah point of view of how to protect ourselves and those around us, but also that we daven to Hashem, who is the source of all healing and blessing. So I'm going to say these words of Tehillim. Please pray along with me. The words are on the screen in Hebrew and in English. Shir Hamalos Mimama Kime Karasicha Adonai Adonai Shima Bekoli Tiena Osnecha Kashuvos Lekol Tachanunai Ima Vanos Tisha Maria Adonai Miyamo Idkimecha Salicha Leman Tivarei Kivisi Adonai Kivisanavshi Velida Varoch Alti Nafshila Adonai Mishomrim Laboker Shomerim Laboker Yachel Yisrael Adonai Kim Adonai Chesed Ve'abei Moifedus V'hu Yifdes Yisrael Mikol Avonosav. And I want to just conclude, this week's parasha has a very important message for us in this time, because we're going through a very difficult time as a community and a country, with so much suffering and death around, and it's a time of tremendous difficulty and challenge. And this week's parasha is a double parasha, Matos Masei, and it's the conclusion of the fourth book of the Chumash. And in the second parasha, it is about the journeys of Am Yisrael, of the Jewish people in the desert. It says, Eile Masei, these are the journeys, and it lists out all of the places in the desert that our ancestors stopped in the 40 years that they were in the desert, between leaving Egypt and entering into the promised land, into the land of Israel. And the Torah lists each and every single place, and it says that they journeyed al pi Hashem, in accordance with the instruction of Hashem, in accordance with the will of Hashem, because we know that when they were in the desert, they followed the pillar of cloud in the day and the fire at night to show them where to go. And so they followed Hashem through the desert. They didn't know where they were going. They were on a journey, and they didn't know what the next destination was. So they went on this journey. They were always they were unaware. There was a sense of uncertainty about what the future held, but yet they were following Hashem, and they were together, and they went on this journey, and they got to their destination in the end. They arrived at the promised land. And I think there's a very important and powerful message in this week's parasha for us, because we know the parasha is always there to give us a message for our times, for the struggles for the opportunities that we are going through, for all of the situations that we are grappling with. And the message of our parasha, I believe, is that we as a community, a country, and indeed as a world are on a journey. We've been through a journey since the beginning of this pandemic, since February, March of last year. And it's been a long journey, and a journey of many twists and turns and stops along the way, like they were in the desert, stopping in different places. And sometimes you arrive at one destination, you don't know when the next is coming and where things are headed. But when you're on a journey, we need to take strength on that journey, because we can't predict, and it's in any situation in life, not just in a pandemic. Life by definition in this world, we have all plans, as it says in the book of Psalms, Rabot Machshavot B'Leivish, that we have lots of plans, but in the end we're not in ultimate control of where we go to. So there is an element of uncertainty that is built into life itself, and we are feeling it more acutely during a pandemic. But indeed, all of life has that dimension of uncertainty woven into it. But when we go through these times of uncertainty, and when we face the unpredictable nature of life itself, we do so and we draw strength from two things, the same things that our ancestors in the desert drew strength from. Firstly, they were together. They weren't on their own. They were journeying as a nation. They encamped in their tribes. They were with their families, their tribes, the entire nation of Israel together. And so too, as a community, we're going through this journey step by step together as a community. We're not doing it on our own. That's why these weekly updates are so important, because we shouldn't feel alone. None of us should feel alone, because we can see all of the support that we have within our community, and it's so important that we have that sense of togetherness and that sense of unity, and that gives strength. But also it says in the parasha, Al Pi Hashem, they journeyed with Hashem. They had God with them every step of the way, and we have Hashem with us. He's with us, holding us and supporting us every step of the way. That is part of what it means to have a close relationship with Hashem, that sense of faith and connection to Hashem. And so we do this journey together, but we do the journey together with each other, but we do the journey with Hashem, and we feel His love and His presence. Even when we are going through times of tremendous suffering and difficulty, we are never alone, as it says in the pasuk, in the verse in Tehillim, that King David said, Ima Anochi B'tzara, God is with me in my times of difficulty and challenge. And King David wrote those words in Psalms, knowing what personal difficulty and challenge. He went through enormous times of difficulty. He lost a son in battle. He went through times of tremendous trials and tribulations, of coups that were staged against his kingdom. He went through so many difficult things, and yet he always felt the hand of Hashem with him every step of the way. And so too, let's continue our journey. Eile Maseh Hashem, the Maseh B'nai Israel, these are the journeys of the children of Israel. We're on this journey, but we're not alone. We have each other, we have Hashem, and the path we go step by step towards our destination, towards better days, and we continue to daven to Hashem that He brings health and healing to our community, to our country, to our world. I want to wish everybody a Shabbat Shalom, and thank you for joining.